What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Auto insurance can all seem the same until it comes time to use it. So don't get stuck paying more for less coverage. Switch to USAA Auto Insurance and you could start saving money in no time. Get a quote today. Restrictions apply.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
What did the tortilla chip say to the cheese? It's not your business. Why did the farmer trade cow manure for goat poop? It was a dung deal. Why was the math teacher such a good dancer? She had algorithm.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the weirdo alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we've got Tacy, my partner in all things. Hello, Tacy.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question that you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POO-HEAD. Yeah, give us a follow at Weird Medicine on Twitter or at drscottwm, and visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. All right, very good. All right, Dr. Scott, what the hell?
I like it.
What the hell? I should get that drop. What the hell? All right.
I like it.
All right, check out Dr. Scott's website at simplyherbals.net. Don't forget to go to stuff.drsteve.com. That's stuff.drsteve.com for all of your weird medicine and Amazon needs. And check out, if you want, look, it is the season, right? So if you go to stuff.drsteve.com, you can go straight through to Amazon. But you could scroll down, and if you have a guitarist or a bassist in your entourage and you want to buy them an inexpensive gift, but it's cool AF, get them the Rode guitar tuner. It's robotic tuner. You just hold it up to the key and then pluck the string, and the dang thing will spin it. It'll also string your guitar for you or unstring it, so it's pretty neat. So check that out at stuff.drsteve.com, or if you want to go there directly, it's Roadie, Roadie, shop.drsteve.com. Check out Dr. Scott's website, as I said, at simplyherbals.net. And check us out at patreon.com/weirdmedicine. I think we're going to have some fun over there, do some slightly different things. I'm going to try to do a live stream one of these nights just to test it. Tacey, I've got some new software.
Okay.
And if that works, we'll do that.
Okay.
And then if you want me to say fluid to your mama for Christmas, then or Kwanzaa or Hanukkah or any other holiday, or just for the hell of it, go to cameo.com/weirdmedicine. It's cheap as hell. I just do it for fun. It helps buy me ham radio stuff. That's all that goes into a fund, and all ham radio purchases come out of that. And I'm really wanting this antenna, so if you guys would do some cameos. No, I'm just kidding. I need some new finals for my transmitter, don't you know? All right.
Sure.
Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And did want to say happy birthday to our network founder, Cardiff Electric. It's his birthday today.
It is not. It is not.
Most certainly is.
No, it's not.
All those other times that I said it was his birthday, I was just kidding.
And that's what you've said all those other times.
I was just kidding.
You're a big fat liar.
Now I'm telling the truth. All right, you got any medical questions, Dr. Scott?
No.
You have some articles, though, that you want to
I do have some articles.
There's one that I'm very interested in about a chronic illness that we have no really legit treatment for right now, and that is Huntington's chorea. So go, my friend.
Yes. So cellular housekeeping process implicated in fatal neurological disorder.
Okay.
So neurons that made from Huntington's disease patients and skin cells shed light on some cognitive decline. And as you said, Huntington's is a devastating brain disease that is genetic.
Yeah.
Passed down through.
Yeah, and that's why we don't screen for it.
Yeah, and it's
because we don't have a treatment for it. So if you're going to screen for it, you're just telling people, well, you're going to get it. Then, they live their whole life wondering when
it's going to start.
The sort of Damocles is going to. So it is a choreiform illness, which means it's a movement disorder, and they get involuntary jerking or writhing movements. And the writhing movements, the people who are watching us on camera can see it, but it's kind of rhythmic writhing. Like if you were making, how could I explain it? Like let's take your right arm and make it look like a snake on the ocean. Up and down in the surf and side to side and up and down and round and round. That's what chorea is.
Yeah.
Okay. And they get rigidity, muscle contracture, and all kinds of problems. And it is ultimately fatal. And it is rare, fewer than 200,000 U.S. cases per year, but still, that's out of 350 million people. So let's say, half of those are adults. It's still a lot of people.
It's a lot of people. And devastating to families.
Oh, absolutely.
Because typically it does wipe out a couple in a family. It's
yep.
awful. But it looks like at the Washington University School in St. Louis, or School of Medicine in St. Louis, they're doing some research on what exactly is going on and how possibly the aging triggers a loss of crucial process of the dying process of these cells in the brain.
Okay, so here's the thing: if one of the reasons we can't fix it is we don't know what causes it. I mean, we know it's a genetic disorder. We know what gene it is. But just like ALS or amyotrophic lateral sclerosis, which just recently they sort of found the mechanism for it. Once we know the mechanism, we can target it.
Right.
With drugs or other treatments. So we need to know what the mechanism is. So go ahead.
Well, and it's talking about the Huntington's disease destroys a specific type of brain cells called medium spiny neurons, which do cause the involuntary muscle movements. So they're uncontrolled involuntary muscle movements.
Yeah, I think what they actually do, those neurons actually inhibit those movements. The movements are always there, but they're inhibiting them. When you take them away, then they're not inhibiting them anymore.
And typically they show significant cognitive decline. And typically once you get to diagnosis, it's kind of a maximum 20 years. Is what
20 years?
Yeah, that's what they live about 20 years after the signs of the disease that first appear.
Oh, okay.
First appear. Yeah, I'm not saying that after they progress.
Okay.
So it's pretty incredible.
So what does this story tell you?
Well, I'm scrolling down.
Oh, for fuck's sake!
Hey,
Okay.
you're the one.
Okay,
who found
well,
it.
I'll temporize. So it's autosomal dominant disorder, which means that you only have to have one copy. So if you have, okay, let's do big H, little h.
Okay.
So you have someone that has big H, little h, meaning that they carry the copy, but they have Huntington's disease.
Right.
And they mate. You look while I'm talking to the.
well,
you look up your thing, and I'm not
Make sure
educating
that your
you.
math is correct.
Right. Okay. Well, that's fine. And then they marry somebody that's little h, little h.
Gotcha.
Okay. So the first kid will be big H, little h. The second, or, there's this 2x2 box. You'll have big H, little h, big H, little h. And then on the next two boxes will be little h, little h, little h, little h. So that means 50% of their kids, the kids have a 1 in 2 chance of carrying the gene and therefore having Huntington's chorea. So that's a tough one. A lot of those people decide not to have children because, we don't have a treatment yet. Now, you could say, well, surely to God in, 30 years we'll have a treatment for it. But, people have been saying that for a long time. So what'd you find out?
Well, so what they did, from what I've gotten so far down this, it's a big article, but they compared older people who had gotten Huntington's with younger people.
Yeah.
And what they hypothesized that there has to be some sort of a change as these kids age and grow into older people. And what they found is that if they can, the bottom line is what they're doing with this is they're going to start doing genetic alterations to these messenger RNA cells.
Messenger RNA.
That hopefully will stop the changing of these cells that develop into this Huntington's disease.
So how are they going to do this?
By modeling different stages of disease across the lifespan.
Oh, my God.
They identify roles in the disease onset. Hell, I'm reading as fast as I can. I swear I am.
That's okay. Well, it's okay. So it's
but this is not like a normal article because it doesn't have a conclusion on here. So normally I get down to a conclusion.
Yeah. You normally could just read the abstract.
Yep.
And pray that it reflects what's in the article.
Exactly.
So it's caused by an expansion of these sort of things called cytosine, adenine, guanine repeats. And what those are that's genetic material that expand. I guess most of us may know that you've got 4 nucleotide bases that form the code that makes DNA and RNA, right? Okay. And then the only difference is there's uracil instead of one of them in the RNA. Anyway, and it's been a long time since I took that, so the geneticists are screaming at the radio. It's fine.
Both of them.
Yes.
So right.
Or
if
one.
If there or some student in high school that just took this. But anyway, these things code for all of our proteins. And if you ever want to see something really cool, go to YouTube and search for 3D animation of transcription mRNA. It's the most amazing thing you've ever seen. Mm-hmm. These little tiny machines in all of our cells that are just stamping out proteins. Yep. With this crazy mechanism. Anyway, I did go over that mechanism on our YouTube channel once, so you could search there for that if you want to see it. But so anyway, you can get these expansions of these repeats where these 3 signals will repeat endlessly, and what it does is it just screws up the protein generation for that gene is supposed to be coding for, and you get a malformed protein or you get no protein at all, and then this happens. So.
Yeah, and I read a little further down, and what they're doing is they're trying to interrupt that initial process so that maybe they can
expansion.
Yeah, they can turn it off so that it doesn't expand, so that it doesn't develop into this full-blown
Well, that'd
disease.
be awesome.
Yeah, and Dr. Stevens at the bottom, they're talking about what they're hoping is they can actually use this to help with other neurological diseases like Alzheimer's. and possibly ALS and things of that nature.
Well, they always say that. Well, we had this breakthrough, and perhaps it will, whatever.
Yeah.
I'll believe that when I see it, but I would like to see it.
Heck
I'm
yeah.
not going to root against it. That's for sure.
No.
So, all right.
That's good stuff.
Yeah,
Good
it's crazy.
stuff.
What else you got? So really, what Scott could have said, and we wouldn't have wasted 11 minutes, is they made a breakthrough in treatment for Huntington's chorea. Stay tuned.
Yes.
Okay.
Thank you so much.
But that's good. I'm glad that
eloquently.
people are still investigating this, and we're moving forward.
Yeah, shoot, yeah. Well, here's the one that had my attention. It was the shocking study that finds nose picking could increase risk of Alzheimer's and dementia.
Yeah, I like this one. This one's important.
Yeah.
No, it is.
It is important because, it's interesting, but they're showing that there's so much research going on with Alzheimer's right now, but at Griffith University, scientists have demonstrated that bacteria can travel through the olfactory nerve in the nose and into the brain in mice, where it creates markers that are a telltale sign of Alzheimer's disease.
Wow.
And guess what the name of this bacteria they were studying?
What is it?
Chlamydia.
What?
Really?
It's not trachomatis, though.
No, pneumonia.
Okay.
Yeah, chlamydia pneumonia. It's a
Yeah,
bacteria.
chlamydia trachomatis is the one that causes the STD.
Yeah,
there are lots of different chlamydias.
Yeah, well, yeah, lots of chlamydia.
That's
Like there are lots
stupid
of
effing chlamydia.
I know it. It's just chlamydia is bad. Period. I don't care where you have it. If it's in your nose or your nuts, it doesn't
brain
matter.
chlamydia.
It's just bad.
Talk to your grandmother who's got Alzheimer's. Say, well, you got chlamydia in your brain.
Yeah, I'm pretty sure that won't go over super great. But what they're saying is that with this, that
maybe that's what's wrong with your mom, Taze.
Maybe.
Is she a chronic nose picker?
Of course she is.
No, I've actually never seen that.
No.
Mm-hmm. She's a closet nose picker.
So this is actually
maybe.
Yes.
pulling hairs also increases the risk too, if I remember reading this article correctly. So because that creates another pathway.
Yep. Well, the stupid viruses and bacteria figured out that a really easy pathway into the brain is the olfactory nerve.
Well, sure,
because it can bypass the blood-brain barrier. So it's
because it's wired directly into the brain.
It's straight in.
Yeah. So the olfactory nerve is the nerve that we use to smell with.
Yep.
And it has all these chemical sensory apparatus on the end of it. And depending on how those things are stimulated, you experience that as a smell, which is really amazing.
It is pretty wild.
And the reasons dogs' snouts are so long is their olfactory nerve is longer than ours. And so they can pass a lot more information along the top of their snout to determine distance and much more sensitive analysis of the smells that they're smelling. And apparently they can tell what direction it's coming from.
Yeah, it's incredible. And we went for a hike through the woods yesterday, actually. And there's so many leaves up on the mountain, it's really hard to see the path. But my golden retriever, she's got her nose to the ground. And
she's smelling people's feet,
and where we've been down these paths before.
Yeah.
So heck, I'm just looking around at the leaves and the trees, and she just
isn't that something?
Takes me right through the woods. It's incredible.
I remember we did a horseback ride thing, and our horse was so used to doing the path that we were on that it fell asleep. And it just we just walked the whole thing, and when we got there, the horse person said that horse is sound asleep. Just
Are you
walking.
kidding?
Yeah, that's what they said.
Oh my gosh.
They they get so bored they just go to sleep and I'm back at the barn. I wonder how that happened.
Oh my goodness, that is funny. Well, the take home message here is that picking your nose hairs and picking your nose and plucking your nose hairs is not a good idea.
What should you do instead?
Some Simply Herbals nasal spray.
Okay, I don't disagree.
Number 2, lavage.
Yep.
Lavage is wonderful. Clean out that crud in there, but don't mess with the.
Give yourself a bill.
Yeah, don't mess with that endothelial lining. It's a little tweaky in there.
Well, yeah, it's not really endothelial lining in your nose. No, it's a mucous membrane. Endothelium. Endothelium is on the inside of blood vessels.
Yeah.
So, just don't mess with the
don't pick
mucous
it.
membrane.
Yeah, don't pick it.
And
The mucous membrane.
so that is a good advertisement for the Navage, which I still think
Better
for
advertising
$89 or whatever it is the best under $100 thing I ever bought.
Better advertising for the Simply Herbals, but
Yeah,
I'm biased.
do both.
Do both.
You
that's
can
right.
carry the Simply Herbals
In your
around
pocket
that you can
around,
get
yeah.
at Dr. Scott's stupid website. And you can carry that in your pocket, and then when you get home, you do the Navage, which you can get at stuff.drsteve.com.
Wash it out of your old noggin. That's a good thing. You can lose weight while you're doing it, too.
Isn't that interesting, though? So, do they really have data that shows that people who pick their nose, is this just a hypothesis?
I think it's a hypothesis.
Well,
yeah.
what does it say? Did they actually do a study? Or
Oh, hell,
they...
I didn't read it that far down.
Oh, for fuck's sake.
No, I was just enjoying
You
it.
want to start sending the articles to me?
Would you read them? And then
I might.
know a little bit
It would
more
be
about
worth a shot.
I'll send some of them
retired.
to you.
Huh?
You're retired. Your dance card is full.
Okay, let's just look up if there's a correlation between dementia and nose picking.
Are we still on? or
Yeah,
did
we're
you-
on.
Oh, you're not even
Okay, this is a
pausing?
mouse study, suggests a surprising link. Okay, so you did say that.
Yeah.
That they had data in mice, is what it was. What they do, they go in there and then pick the nose of the mice.
Oh.
With a little tiny mouse finger thing. And then, so we're the first to show that chlamydia pneumoniae can go directly up the nose and into the brain, where it can set off pathologies that look like Alzheimer's disease. Okay, yeah, very good. Saw this happen in a mouse model. Evidence is potentially scary for humans as well. Stop saying shit like that. Scary is not a scientific term.
No, it's not.
That is a clickbait, go fuck yourself term. And whenever I see that, and I wonder if this neuroscientist said it or if the journalist kind of, just changed a word or two in there when they're quoting this person. Anyway. All right. Okay.
Mm-hmm. Good stuff.
Is it, though?
I think it's good stuff.
Okay, you got anything else?
No. Well, I've got that one from bacterial sensors, but I'm just going to tell you, I didn't pre-read it. So you can start raising it.
Why do I send these things to you?
Well, hell, I don't know.
All right, that's fine. Okay, here we got a quiz question.
But we do have
for
some.
everybody.
We do have some questions though.
All right. Well, we got this one.
Dr. Steve, hope you're well.
Hey, thanks, man.
Oh, really?
You too.
I don't care.
Okay.
Anyway, Casey. Oh, yeah. Scott.
What's up?
Yeah, anyway. Quick little question here. How much saliva does a human body produce in 24 hours?
There you go.
Ta-da!
Now, that's a great question. So, one person suggested to us, Tacey, that on our Patreon show that we do like a quiz, and we could have questions like this, and then, have listeners, compete for prizes somehow. I don't know how the hell we would do it, but this is the kind of question I like.
Okay.
So it's an excellent question, because I don't like those ones that they do on those morning zoo things. Well, 26% of people said this, and then it's just luck. Who the hell knows? What that in the fuck that could possibly be. But this is, you could guess this. So let's express it in liters. If you're not a metric type person, you know what a 2-liter bottle holds. So that's 2 liters. So we're going to express this in liters. Scott, what do you think?
Sounds good to me.
No, I mean,
I like liters.
how much? Okay, good. How much saliva do you think you produce in a day in liters?
A half a liter.
Okay, Tacey.
Isn't it different depending on the day?
Okay, I'll give you that.
Give yourself a bill.
So give us an average.
I'd say
Don't take too long.
a quarter of a liter.
A quarter of a liter. Okay, let's see if anybody in the exam
I
room.
liked Scott's, but I didn't want
Oh,
to.
you like Scott's? So you like Scott's? Well,
Damn it! I'll say
but
a
I
liter
wanted
and
to
a
be
half.
different.
Okay,
I'll
so
say
Scott
liter.
said 0.5 to 1.5 liters.
Give yourself a bill.
That's exactly right. That's exactly the range. It's 0.5
Well, that's a good guess.
to 1.5 liters per day
Okay.
of saliva.
That's a lot.
It
Spit.
is. So let's just say that the median is like 1 liter.
Oh, can you imagine just spitting all your saliva out into a Pepsi or a Coke?
Well, there are.
I can.
2 liter.
Yeah,
I did Copenhagen for years.
He dips snuff.
Oh, yeah.
I spit most of it out. Yes, that's true.
So, yeah, that's probably why he was so good at estimating that. Someone that hasn't ever dipped probably would have trouble with that. Also, there are some people that have to spit everything out because they have an obstruction of their esophagus. And saliva will get down in there and it's got nowhere to go, so they just start having to spit it out or drool or whatever. Or people that have head and neck cancer that causes the salivary gland to be wide open. Instead of coming out the salivary duct, it's just leaking out into the mouth, and sometimes those people will spit out all their saliva as well. But yeah, so if you sat there for 2 days, you could fill up a 2 liter with saliva. And then I would pay someone $1,000.
Oh, that's so disgusting.
To drink it.
That's gross.
Try it right now. Anybody that's listening to this.
I'm sure they're running to get one.
Now go get a spoon. Just get a tablespoon. And let the saliva drip out of your mouth onto the spoon. And then when that tablespoon is full, then just stick it back in your mouth.
Yeah.
It was there just a second ago.
Or you could just watch TV.
Why is that gross?
If you're bored.
But it is gross. It was right there. Swallow right now. You're swallowing that same saliva. And that's not gross. But if you spit it into a spoon and then try to put it in your mouth, it makes you sick to think about it.
Yeah, it's pretty gross. Just saying.
That is gross. You know what else is gross? I made homemade sauerkraut, and I'm nervous about trying it. So I got this fermentation thing, which is really fun if you're going to do make hot sauce. Making fermented hot sauce is the way to go. And it's just you ferment it in brine and peppers and cabbage and other things.
Kimchi.
Yeah, right. Well, do you like kimchi? I'll make you some.
No, I like kimchi.
I like doing it. I don't know if I'm going to like to eat it.
So, geez, you're
that's fine. No, it won't. I have the thing. And so they all have lactobacillus on them. And lactobacillus will ferment peppers. It's not like using yeast that we do for fermenting, say, wine and beer.
Right.
You're using bacteria. And the peppers will ferment in there for a week or two, and then you puree them and then put them in a food mill and get the liquid out. And then you take the liquid and measure it. Say it's a liter, then you would put 0.4 of a liter of vinegar, like apple cider vinegar in there, and then add, salt to taste, and you've got the best hot sauce you've ever made. And so I got this thing. And it's like, well, now, I've fermented all my peppers. Now what? And so I made some sauerkraut. And it's just cabbage and salt. That's it. And it's got to be the right concentration of brine. It's 2 to 3% brine. And so, but I've got the fermenter lids and everything. So if you want me to make you some kimchi, I'll make it for you. Because I am kind of all about fermenting right now. I don't know if I want to eat it, but I'd love to make it for somebody. And it is probiotic and all that kind of crap. It's lactobacillus. It's good for you.
Good for you.
All right. Why was I talking about that?
I don't have any idea.
I don't remember.
Fermenting
Started out with slobber.
Yeah. Okay.
And devolved into...
Yeah, I guess it was just other things that I don't want to put in my mouth. Maybe that's what it was. All right, let's do this one. This is a very interesting question. You ready to take some questions?
Yeah.
Number one thing, don't take advice from some asshole on the radio.
Thank you, sir.
Got another little weird question for you here. I don't know if you want to call it scientific or what, but I heard a study the other day that if you're drinking and you're using a chaser,
a mixer.
that if you use a Diet Coke, you will get you'll get drunk about 20% faster than without because of the aspartame. Is there any truth to that?
That's an interesting question, and I admit at first thought it was probably malarkey, but what do you think, Dr. Scott? You guys got any opinion on this? Because I do have the answer.
I would say, with your answer, I would say it's true.
Yeah.
Right.
But
exactly.
my gut would have said,
why? Yeah.
My gut would have said, hell no.
I know, it just seems stupid, right?
No chance, yeah.
So it turns out that the body recognizes sugar as food, and that slows down the rate of alcohol absorption into the blood. Whereas diet sodas, which include have aspartame in them, the body doesn't treat that as food, and the alcohol gets absorbed faster. And you will notice that if you drink a diet soda, you're going to get hungrier and you're probably going to eat more because and I'm not saying that you should drink sodas. Just don't drink something that fools your brain.
Right.
Because it is sweet enough to fool your brain into thinking calories are coming. And then it's going, where the hell are they? Where are the calories? And then it starts generating these, hormones that stimulate your appetite, increase absorption of things like alcohol and stuff like that. So it's pretty interesting. Yeah,
I would have never guessed that.
Yeah, they did a study on this, and people who drank diet soda as a mixer had higher alcohol levels that increased more quickly and peaked at a higher level compared to people that mixed it with regular soda. Again,
another good reason not to drink sodas.
Right, at all. Just don't drink them at all.
Yes.
Isn't that crazy?
It is bizarre. I can't think of the last time I actually had a.
No, and it's like, I'm low carb, so I'll just drink neat whiskey. Mm-hmm. And if I drink beer like I did in Rochester with Sean and them, just forget it.
You end up standing on a table and screaming at
screaming
band.
MF at the band at the top of my lungs.
The good old days.
Yeah.
So sad I missed that.
Good old days.
Where was 2 weekends ago?
Or when was that? When was the roast, Taste?
It wasn't
about
long
a month ago.
Yeah,
it was about a month ago.
Yeah,
about
anyway,
a month ago. Yeah, I love it.
I'm just standing there in front of the band, just doing either the fist or the devil horns and screaming.
So ashamed.
Oh Lord!
There's just no reason for it.
Nope.
He's out of control.
Nope. But anyway, and I blame it on the carbs in the beer. If I'm drinking just whiskey, or bourbon, I'll just have one and I'm fine, and I'll just sip on it. But I ask places, do you have diet mixers? Because every once in a while I wouldn't mind a vodka and diet tonic. Right? No place ever has that. They have, we have Jack and Diet Coke. It's like, I will not. That's monstrous.
Yeah, no thank you. No thanks.
Anyway, okay. Nobody cares what I think about that.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Hi, I'm Lara. After 20 years of making Larabar, I still believe that simple and real can be indulgent and delicious, which is why we're introducing Trail Mix Bars, our newest Larabar made with 51% regenerative almonds. Learn more at larabar.com.
This episode is brought to you by PNC Bank, who believes some things in life should be boring, like banking, because boring is steady, pragmatic, responsible. You don't want your bank to be cool or sexy. Sexy is for red carpets, not banks. That's why PNC Bank strives to be boring with your money, so you can be happily fulfilled with your life. PNC Bank, brilliantly boring since 1865. Brilliantly boring since 1865 is a service mark of the PNC Financial Services Group, Inc. PNC Bank, National Association, member FDIC.
All right. Here's a Jim and Sam question. Hang on. Not sure what this is.
I just want to say I think Jimmy is... I love Jimmy, but I think he's wrong when he says the Beach Boys' Pet Sounds is overrated, and Sam is right when he says that Jim is wrong about that.
Okay.
Thank you.
Okay. All right.
Dan from New Jersey.
Yeah, hey, dude, you know who else agrees with you? The Beatles. Yeah. When Pet Sounds came out, they were freaking out because they were, I can't remember what album they were working on, but I remember reading a biography of the Beatles where when Pet Sounds came out, they were huge fans of Brian Wilson. They were like, can we ever do an album that's as good as this? And the answer was a resounding yes.
Yes. Time's up.
But it's interesting that it gave them pause. They felt like their number one competition was Brian Wilson.
So just a quick synopsis. What the hell is this guy talking about?
Pet Sounds, the album Pet Sounds.
No, but what's the Sam thing?
Jim and Sam.
Yeah. I don't know what he's talking about.
Jim and Sam. It's a show that it's the flagship show of this channel.
Right.
And you wouldn't know that because you don't listen to anything.
No, I only listen to
hippie music.
I listen to this in the Grateful Dead channel. That's about it.
Yeah.
I listen to this show on Saturday nights
So
at
it
7
was
p.m.
Opie and Anthony on it wasn't the virus. Was it the virus when it first? It was High Voltage, right? High Voltage. Then it became the virus. Then it became Opie and Anthony. And they moved over to Sirius when Sirius and XM merged.
Merged, right, okay.
And then it was Opie and Anthony, and then Anthony got the old heap-ho, and it was Opie Radio,
Right.
and then Jim and Sam said, hey, we'd like to do the morning show, and Opie was nowhere to be found, apparently. This is what I heard.
Mm-hmm.
I've never talked to him about. And they kind of slid in and got the morning show, and Opie went to middays or early afternoon?
I don't remember. I don't
can't
remember what you're talking about.
And then he had his own show with Carl Ruiz and Vic Henley and Sherrod Small, and then Jim and Sam became the morning show, and then Opie got the heave-ho, and now it's Jim and Sam.
Okay.
And it's still called Faction Talk because it was Jason Ellis's channel at one point.
Mm-hmm.
But Jason is long gone, but it's still Faction
I
Talk.
can see it now, the Dr. Steve channel.
Yeah.
No.
Mm-hmm.
The Weird Medicine channel.
You know it.
Weird Medicine channel.
I would love that. Well, they were always, don't you want to go to Dr. Radio? It's like, hell no, I don't want to go over there.
Bunch of hacks.
Well, I don't have any history with them except saying things like that. Oh, I'm sure they would welcome me with open arms.
As they should.
I've shit on them for 17 years.
Oh, Steve, you know they don't have any idea that you even
Well, they
exist.
would, though. Somebody would tell them.
They could care less.
Anyway, so that was a Jim and Sam question. All right, here we go.
Hey, Doc. Derek from Texas. Hey, I got a question for you.
Derek, wait.
I've had some kind of upper respiratory cold.
Derek from Texas can't be the same one.
Tejas.
Okay. This is Derek from Texas. You remember him on Howard Stern?
Mm-mm.
It was Eric the actor, when he got kicked off, or he said, I'm never coming on here again, or he got kicked off or something. And he called in as Derek from Texas with this horrible pseudo-Texan accent. Didn't fool anybody. It was just his way to kind of get back on the channel again. It was funny. Anyway, let's start this over again.
Hey, Doc. Derek from Texas. Hey, I got a question for you. I've had some kind of upper respiratory cold type shit for like 3 days.
Yeah.
terrible coughing and shortness of breath and wheezing.
Yeah.
And my question is, where does
I wonder what that could be, but anyway.
that wheezing and shortness of breath and that rattle, where does that all come from? And,
Excellent question.
And what entails all that?
Yeah. Dr. Scott, you want to take a shot at that?
Fluid.
Yeah, that's true.
That's causing the rattling and the...
It is.
And, yeah.
So the virus or whatever is in your airways is causing inflammation in the airways, which causes fluid and mucus to accumulate, because that's the body's response to this thing, is put fluid there because white blood cells can't float around on air. And they can't go through dried out tissue or solid tissue, so they need little fluid to move around in. So exude some fluid in there, and then what happens is you get an accumulation of fluid in the tiny little airways. You have these big giant airway up here, and we say big giant, but it's really an inch, maybe an inch around in diameter. And then it divides, and it divides again, and divides again, and you keep dividing a few times. Now you're in microscopic territory.
Right.
And you get a little bit of fluid in there, and then you're passing air past that. It's like the flatus flute. When you pass air through a little orifice like that, it'll whistle. And if you ever really want to hear true wheezing, it sounds, or if you ever hear true wheezing, it's not the upper airway kind of like that. It is. It's if you put your ear up to someone or use a stethoscope that has asthma and they're actually wheezing because all of their airways, the microscopic airways, are constricted. It sounds like, like what you would imagine hell to sound like, a choir of just evil entities all screaming at the same time and in different pitches. That's what it sounds like. I wonder if
Which is completely different from the hearing fluid in the lungs, where you'll hear where you actually hear the gurgling and sometimes nothing at all.
That's right.
And something.
So wheezing are the tiny little airways, and we get constriction of the airways. And then there are rhonchi, which is basically what Scott's talking about. Those are, and then you can have stridor, which is up top. That's when you've got narrowing of the trachea, and you got that's stridor. So let's see if we can find some audio of wheezing here somewhere, because I'd love for you guys to hear that. Yeah, here's end expiratory wheezing on Meds Cool. Let's see if this is cool. And when you really hear that's a recording of a recording that's going through a bad microphone or a bad stethoscope, so it sounds even crazier than that. Now, you can also have crackles when you have thin, not mucus and not narrowing of the airways, but just fluid collection in the lungs. That can happen with congestive heart failure. And when you take a deep breath, you'll hear like cellophane. And that's pretty interesting.
Crackling.
That's right. Let's see. Rhonchi. Let's try rhonchi lung sounds. See if we can hear that on here. Is this fun? I don't know if this is fun.
In this video, we're going to discuss the rhonchi lung sound.
Oh, yeah, let's talk about it for 20 minutes before we do it.
There you go.
Here we go.
Those are pretty severe rhonchi.
I was going to say, if that's you, that's a problem.
You're a mess.
That is a hot mess.
Okay, and then he's got crackles in here, too.
In this video, we're going to talk about...
Okay, that's enough with you. Let's see if we can get... That's crackles. Really, when you really hear it, it sounds more... It's very difficult to record from a stethoscope and make it sound like what you hear in your ears, but it just kind of sounds like crinkling cellophane. Yeah. So lots of different sounds. Like there's many, as sands in the hourglass, so go the sounds in our lungs.
Yes.
All right. Okay, let's try this one.
Hello, Dr. Steve and Dr. Scott and anyone else who's attending today's podcast. I have a question.
Yep.
I had an MRI on my knee.
Okay.
And the results are two. I have arthritis under the kneecap, and I also have pseudogout.
What?
The doctor recommended I have physical therapy, drain my knee, and then have some steroid injections. So what are your thoughts? Thank you very much. Bye-bye.
Okay, you want to talk about the? Okay, I'll talk about doing the drainage and the injection, but you talk about this in general.
Yeah, I'll start first. Okay, so the arthritis under the kneecap is usually called chondromalacia. There's an inflammation underneath the patella, and as you move your knee, it hurts.
Patella being the kneecap.
The kneecap, right? The pseudogout feels like gout, looks like gout. Not actually with the gout crystals in there.
Yeah, but they can't diagnose that with an MRI. You have to pull out fluid and look at the crystals.
Well, I hope people are drinking today with this because they're going to be drinking.
You do blood tests looking for thyroid or parathyroid issues.
Right. Yeah, it kind of makes me wonder about the diagnosis of pseudogout if it's something else.
Yes, I'm skeptical of that. But other than that, okay, we're okay. So
let me give you a real quick piece of advice. Number one, when you any kind of knee arthritis, knee pain, et cetera, a hamstring stretch, getting the leg nice and long, is the best way to lower. Even if you have a Baker's cyst, which is a fluid buildup behind the knee, getting a good long hamstring stretch is really important for the health of the knee because it increases blood flow. Number one. Number two, exercises where you do leg extensions. So, like if you're sitting on a bench and you put like an ankle weight on and you extend your leg up, it causes a shearing in the knee, and it's really the worst exercise you can do.
Oh, I see what you're saying.
Yeah.
The ones where so if you go to the gym and you're sitting in the chair holding on with two hands, and then there's weights on there, and you're putting the thing on the front of your foot, and you're extending your leg.
Yeah.
You're saying those are bad.
The worst thing you can do for arthritic knees.
Yeah.
The best thing you can do, they're called straight leg raises. So just you extend your leg straight out, and then you lift it straight up. So you're not bending your knee, but you're strengthening your quadriceps. And the other thing is just the simple
quadriceps being
the big muscles in the top of your leg, your thigh. And so with the osteoarthritis,
Dr. Scott's the jargon master.
No. But what I am is I'm a knee expert because I've got two arthritic knees.
Yeah.
But the key is really blood flow. And then the last thing I'll say real quickly is that arthritis, if it's gout, pseudogout, whatever, really be careful with what the foods that you eat because you can have inflammatory foods. What irritates my knees, believe it or not, is chicken. I haven't eaten chicken in 10 years, and my knees feel like almost normal. For whatever reason, like shrimp affects gout, chicken affects my arthritic knees.
How did you find that out?
I just quit. I started.
But you have gout, though.
Do I now?
You have gout.
Yeah, I do have gout. So, but I just went on a vegetarian diet, and I mean, I'm telling you, as soon as I quit eating chicken, within 1 week, I had no knee pain. None.
Interesting. Yeah.
It's crazy.
So the way that we have classically diagnosed gout and pseudogout, besides you get a blood test that shows that you have uric acid elevation, then you can make the diagnosis of gout.
You
take out
urine.
the crystals and you look at them under the microscope, and you use a polarizing light. And gout crystals are yellow when they're parallel to the axis of the polarizer. Okay. So yellow urate parallel to the axis. The mnemonic is UPA, Y-U-P-A. And that's how you know this is uric acid. If it's anything else, and the connection, the syndrome is gouty, then it's most likely pseudogout, and you can make that diagnosis again by being yellow urate or yellow perpendicular to the axis. So anyway, and then there are blood tests, et cetera, et cetera, et cetera. So I think they need to make a better diagnosis. But so to take the fluid out, if you have an effusion in your knee where there's fluid in the knee, which you can see, and you poke on your knee and it goes bloop, 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 because it's enlarged and it's fluidy, then it's a very simple process to draw the fluid out. Now, I used to do the lateral approach. There are some people who do an inferior approach. So I would have the person laying down on the stretcher or whatever, table thing,
plinth, whatever.
and put their leg at just about 90 degrees, and I'd feel around for certain landmarks. And then
on the outside of their knee,
on the outside of the knee,
Yeah,
right,
the
on the
lateral,
outside, the lateral part of the knee.
Mr.
And
Big Word.
Yeah, no, you're right. So on the outside, the outer part of the knee, the part that's facing me.
Right.
And then this is a joint, so this is a sterile procedure because if you inject bacteria into this and you get it infected, they're going to be pissed and they're going to be worse off, and it could be catastrophic. So you would treat it like a surgical procedure, so you wear a mask, sterile gloves, do sterile prep, and then you take an 18-gauge needle, and I always would use anesthetic and steroid, so two different kinds of anesthetic and a steroid that had a long-acting and a short-acting steroid in it. And I would get you get the needle in and then inject, so if it goes in easy, you know you're in the right place. The numbing medicine, okay? Directly into the knee, and then you draw out the fluid, or you go, well, aren't you just drawing out the cortisone? And now that I think about it, yes, you are. So that's not how I would do it. I would
aspirate first.
I would draw the fluid out first, and then put the medication in at the end. I'm an idiot. It's been a long time since I've done that. So, and sometimes you would get, we would have these 100 ml syringes. And which is 1/10 of a liter, and you could fill that sucker all the way up with this really sort of beautifully amber, clear fluid.
Wow.
And then you would, unscrew that, screw the one on that had the medication in it, and dump it in there. And a lot of the times, the anesthetic would make them feel better right away. Now you got to tell them you feel better, but don't go jogging because it just feels better. But they would get instant relief and at least walk out of there with less pain than they came in.
Yeah, but it can be a little bit of an uncomfortable procedure when they're sucking that fluid out of there. And
but it feels good, though.
Pressure back in.
Yeah, it feels good though because you're drawing off that that knee feels the pressure of that fluid, and you got to select your patients right. You're not just drawing fluid off anybody. You want to get the ones that have a nice big tight effusion,
fluid, with lots of fluid to pull out.
Right,
because the more fluid you pull out, the better off they're going to feel.
And it feels
if you pull out 10 cc's, they're going to be like, well,
right, yeah, what the hell are you doing? No, you just emptied out my joint space, and now it's bone against bone, or cartilage against cartilage. But we would, they would almost always feel immediately much better.
Yeah, you move it fluid. It does feel better.
So that's how you do that.
Been there, done it.
Now, the inferior approach, you have them sit on the chair, and their leg is at 90, the knee is at 90 degrees, and you can go from below.
Yeah, up into the joint space,
Yep.
Hey, we've got two quickies if we have time.
Yeah, sure.
On the
as
chat
long
room.
as I can answer them.
Yeah. Oh, you can. I trust you.
You think?
Unless you got another one. You ready for this one?
No. I've got a million of them over here.
So Diesel Child, he says,
tell this guy, yes, that sounds like they're doing the right thing.
Yeah, I'm sorry. Yeah, he's doing the right thing. Yeah, but really work on stretching that hamstring, getting blood flow through that knee.
Gotcha.
And that's the best thing to do. So, Diesel Child, he's wanting to know if we have any recommendations for herbal malarkey or anything else that will help
astragalus.
Damn it! You took my thunder. He's pre-diabetic, and he's trying to keep from getting worse. He eats super healthy. He exercises.
What does that
daily.
mean, though?
Yeah, it's all
Some
relative.
people say I eat super healthy, but they're eating, yogurt and stuff, which is healthy, but it's got a lot of carbohydrates.
Sugar,
If it's not sugar free.
Yeah. And
et cetera, et cetera. So I'd be interested to know what he means by he eats super healthy.
Yeah, because some foods convert to sugar really quickly in your bloodstream, and you just don't realize it. And it is healthy food.
Yeah.
But he says he's not overweight or anything, but I guess he is pre-diabetic. So just real quick, a couple of recommendations.
Yeah.
Believe it or not, astragalus does work really well.
Oh, damn you.
It does. I swear it's been shown in research to work. Hey, I should be getting a bill for that. I should be getting a bill.
Well, that's because you're an idiot.
Certainly cinnamon has been shown to help.
Okay.
With blood sugar.
Oh, with insulin resistance, you mean?
Yeah.
Okay.
Yeah. Well, as far as helping people keep their blood sugars under control.
Okay.
And the other one is, oh God, I want to say black cohosh. It's not black cohosh.
No.
It's black, black currant oil. Black currant oil has been proven scientifically. This is not your old buddy Dr. Scott just making shit up, which I usually do, but this is true. Black currant oil has been shown to help with people with prediabetes to keep their blood sugars under control.
Okay, so here's cinnamon use in type 2 diabetes, an updated systematic review and meta-analysis.
So you can buy cinnamon in a capsule?
Yeah.
Yeah, this is in Annals of Family Medicine, not a shit, turd journal. And they did, he's Dr. Scott's holding his
I got my fingers crossed.
So a meta-analysis, remember, is where you take smaller data sets and you mush them together and try to make a bigger data set. So they did a meta-analysis of 10 randomized controlled trials, so that they took, with an average of about 54 patients, they made it into 543 patients. And they had cinnamon doses of 120 milligrams per day to 6 grams per day for 4 to 18 weeks. So they were looking at all kinds of different things. Well, look at this. The consumption of cinnamon was associated with statistically significant decrease in levels of fasting plasma glucose, total cholesterol, LDC, and triglyceride levels, and an increase in good cholesterol, HDLC levels. But no significant effect on hemoglobin A1C was found. Now, so hemoglobin A1C is your average blood sugar. So the question arises, cinnamon, seems to decrease people. It's probably improving their insulin sensitivity, but does it do it enough to have a clinically significant effect? Because we don't care what your blood sugar is. What we do care about is long-term effects of high blood sugar, which are heart attack, stroke, and stuff like that, kidney failure. Those are the 3 big ones. So does it have any effect on that? It's interesting. But, in the short term, particularly in an insulin-resistant pre-diabetic person, why not? I don't think it hurt anything unless it just tears your stomach up. I'd like to see the adverse effects that they had. The other thing is, and definitely don't snort it, and don't take it in a teaspoon like E-Rock did. Just go Google E-Rock, Opie and Anthony cinnamon challenge if you want to see somebody that looks like he was almost going to die. That was bad. So, but I would highly recommend, don't know what your definition of eating healthy is. When you're pre-diabetic, eating healthy means a low glycemic index diet. So you don't necessarily have to go low carb, but you can go low glycemic index. I used to teach it people this way: no white bread, but brown bread. Dense brown bread. It's got to be the dense brown bread. No white pasta, but you can have whole wheat pasta. No white rice, but brown rice, and no white potatoes, but sweet. But you could have yams. So none of the white stuff you can have. You can have anything but that, and that'll get you started on a low glycemic index diet, because what that does is those things are absorbed more slowly, so you get less of a peak of insulin, and therefore you get less resultant insulin insensitivity down the road, because the body doesn't like those peaks of insulin, so they'll just go, I'm not going to listen to you anymore. And then if that doesn't do it, then a low-carb diet will almost always cure type 2 diabetes if it's done properly. And that done properly means lots of green leafy vegetables, fresh vegetables. You can have fruit and lean animal protein. So, a grilled chicken salad with spinach and greens and carrots and tomatoes, stuff like that. Perfectly healthy kind of meal that you could have, and is also a very low carb type of meal. So anyway, what do you think of that?
I like it.
All right. So Dr. Scott, you've got a question from the waiting room, I understand.
Yes, this is from Taylor Adventures. And the question is what our thoughts are about this year's flu vaccines. Are we going to get them, and how effective are they?
Same as they are every year. Get your fucking flu shot. Even the year when it was only 6% effective because they had missed the prevailing mutant. I got influenza that year, had a fever of 105, took Relenza, which is the inhaled version of Tamiflu, and just sailed right through it. Watched 4 seasons of Arrow, on the CW during the day.
Drove his wife crazy.
Well, Tacey was at work, and it was easy.
Yeah.
You know, COVID kicked my ass way worse, and I was only sick for 1 day with it.
Yeah. So what? You've had your flu shots already?
Well, okay. So I am in the Pfizer trial again.
Okay.
With the Pfizer trials, I got the influenza mRNA vaccine.
Gotcha.
And so we'll just, by God, see.
Yeah.
I have no idea.
I have had my flu shot.
Tacey's had hers.
Sore afterwards? Sick afterwards?
I didn't have anything.
No, I didn't notice anything.
Cool. Yeah, I think I'm going to try to get mine tomorrow.
And I got my bivalent, or as Jimmy Dore calls it, is my bivalent.
Ambivalent.
You're
ambivalent.
Yeah, I know. Jimmy, he's hilarious. One of the smartest people on the internet, but he has trouble pronouncing things. And anybody who knows Kurt Metzger, will you tweet at him and say that they need to get, and just tell them they need to get me on that show? I want to get on there. I got a couple of things to say to him. So every year they have to estimate, based on what's going on in the southern hemisphere, what antigens to put in the flu vaccine. So the 2021-2022 flu season was way less severe than typical years. And but there were 2 peaks of flu activity, one in December and then another one in April, and I remember that. And they were thinking it was just had to do with relaxing of social distancing. And then in January and March, people were social distancing because of Omicron variant, and then they relaxed and it came back. But flu transmission rates in other countries are lower than usual so far this year. Flu transmission in the southern hemisphere countries like Australia can help predict what ours should be, and they've been having a milder flu season than usual, so hopefully that will be the case for us.
I read
too.
Australia was awful this year. I'll have to read. Which year are you reading?
This is 2022-23.
I'll have to read. I read it was
So the
awful.
flu vaccine doesn't protect against all strains of the flu. It's still recommended for everyone over the age of 6 months. It's typically about 40 to 60% effective. But the thing is, even if you got to define effective from getting it or effective from getting sicker and shit from it. And even when it was 6% effective from preventing you from getting it, it kept me out of the hospital and most of the people that had the vaccine.
It seems to be bad here.
Yeah.
I don't know how bad it is. I mean, people are getting it, but we're not seeing it in the hospital. You know, again, you got to define what bad means. Are you talking about cases or are you talking about hospitalizations and deaths? You know,
I'm just talking about people getting it.
Yeah, no, I get it. It. Yeah. Well, more people are going to get it because we really put a dent in influenza due to social distancing. Matter of fact, we killed one of the strains of influenza that used to circulate all the time. It hasn't been seen in 2 years now. So we will see how things go. If you are over 65, the high-dose quadrivalent flu zone, a.k.a. the high-dose flu shot, probably gives you better protection. And people who are over 65 are usually more vulnerable to influenza, but not always. When swine flu came around, those of us that were around for the swine flu epidemic in 1972, I think, had already had it. And so the old fuckers were just walking around, oh, you whippersnappers and your flu. And everybody else was getting the flu, but we weren't.
Bunch of softies.
I know. And the flu mist is a live attenuated influenza for people ages between 2 and 49. And it has weakened versions of the flu virus and is supposed to give you better protection. But the last couple of years, it hasn't been available because it just wasn't targeted properly. I believe it is back this year. The dirty little secret about that is if your kids get the flu mist, which Liam and Beck could get that instead of the shot if they wanted to taste, they will pass it to everybody in the house. Mm-hmm. It's communicable. Mm-hmm. And so everybody, you should only give it to people between 2 and 49, but the 60, 70-year-old in the family is going to get it anyway. Mm-hmm. So, it's a little bit of a what you call a medical legal trick there, Dr. Scott.
I hear you, baby.
But no matter what, I just really, the benefits to the flu shot outweigh the risk. And, our buddy Richard David Smith, who is the founder with his wife Shatai of Hyperphysics. Check them out, HYPERFIZZICS, which is billed or sold as an energy drink for nerds. He was like one of those, I ain't getting my flu shot, and he ended up on the ventilator, almost left us. So now he is quite the proponent of the influenza vaccine. And I can't agree with him more. I'm just glad he did okay.
Yes, you, Jeff.
But he's a nice guy. He and his wife both came to the studio. They're quite
Did
quite
she make
delightful.
us like chocolate chip cookies or something?
No, that was Stacy's wife, I think.
Oh.
Yeah, Richard's wife, they had the 2 kids that were here, and then they gave us a couple of cases of
The fizz.
sugar-free Hyperphysics, which I quite enjoyed. It's my favorite energy drink. I just can't find it around here. All right. Anything else?
I believe that'll do her.
Is that it from the waiting room, really?
Yep.
All right. We're going to play some music after?
Yeah, let's play some.
All right, let's do it.
We can butcher something.
Okay, well, let's get the hell out of here then. Thanks to everyone for taking, hanging out with us. And listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. And thanks to our listeners, particularly those that hang out with us in the waiting room while we're recording this abortion. And our listeners' voicemails and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Thank you.